SecondOpinionProject.com is the gathering place where doctors are presenting their case for why the nation's lockdown to fight coronavirus has been a medical disaster.
We're looking at an increase in tens or hundreds of thousands of just suicides alone from the increased unemployment.
Cases of depression or drug abuse that were in check have gotten worse. We're seeing that all over the country, every town, every city.
The morbidity and mortality from joblessness and from mental health crises and relapse and suicides, homicides, shootings, all these things are just going to continue to get worse.
They say of coronavirus,
the message has been disseminated that this is some terrible infection that is a killer, that everybody is at risk of dying.
10 times as many people die from other things on any given day.
But we know that 99.7% of people that get infected with COVID survive.
The risk of death in children from flu, seasonal flu, is 20 to 30 times higher than that of the coronavirus. And yet we have never closed schools. We have never asked children or teachers to wear masks. In my opinion, this is child abuse. I am absolutely appalled, and I think it makes no scientific or rational sense whatsoever.
We cannot lock up our young generation in the house for the next 12 or 18 months while we're waiting for a vaccine.
First of all, there has never been a successful coronavirus vaccine. Never.
The kids need to go back to school. They need to go back to school for the main reason that they need that social interaction, and there's nothing that can replace a childhood for a child.
We're talking about not only social isolation, depression, boredom, but we're also talking about a strategic loss in education. If you take a look at what happened in Boston and some of the other places where they had online schooling, 20, 30, 40% of students didn't ever log in.
What is driving the current response to this coronavirus is pure and unadulterated hysteria. This is actually a full-on societal anomaly that has infected virtually everyone in the country to some degree. We have to understand that it's nonsense. Otherwise, we're going to be locked into that in perpetuity.
It seems people think it's more contagious than it is. People who catch this virus are in close proximity for several minutes, possibly even an hour or two with the infected person.
When you're outside and the sun is shining, the chances of spreading this disease are practically zero. If this virus gets hit by sunlight, it dies in a second.
This virus is very unlikely to spread outside, so it doesn't make any sense that parks and beaches are closed at this point.
Some 1,200 doctors are involved in the Second Opinion Project. Many tell of people who died because they were too scared to go to the hospital.
He declined because he was afraid he would catch the virus. He basically waited to the last minute. 911 was called, EMS showed up, and he, arrested right there, had CPR and didn't make it.
And as he got weaker and weaker, they didn't know what to do because they were getting constant bombardment from the news saying, stay home, don't go to the hospital, you're going to get COVID. We coded him for about 30 minutes and he passed away.
I've had several patients who were worried about going to the emergency department when they clearly needed to go.
I still have several patients that are afraid to come to my office. They're afraid they're going to catch it on the street, walking down the road. And that's just not the case.
Even Dr. Fauci has warned lockdowns could cause irreparable damage.
This is not a money for lives situation. This is a lives for lives situation.
The consequences in terms of mental health for many of my patients and many people throughout this country are devastating, and it's going to get worse the longer that we keep our economy locked down.
You need to start rising up and telling these officials, look, we respect you, but you're not a doctor. And in this country, we have rights. All our people in this country, we're endowed by a creator. We have rights and civil liberties, and we get to choose what we want to do, not have government dictate medical health care issues on us.
These doctors, representing more than 21,000 years of practice, have even written to the White House to warn of the millions of casualties to come because of the lockdowns. Paul Strand, CBN News, Washington.